I traveled to Cell in Kyiv, Ukraine, where fetal stem cells got their start over 20 years ago. While undergoing Cell's 3-day longevity anti-aging program, Cell allowed me to document my entire treatment program and film their laboratories and facilities. This is my Cell experience. Unlike most medical clinics in the United States, Cell tested my blood and urine in their lab on site. It is from these lab results, in addition to a full ultrasound and electrocardiogram, that Cell's doctors designed a special protocol just for me, which consisted of a variety of fetal stem cell types, a 3-day facial using fetal stem cells, hyperbaric oxygen sessions, and even massage to help keep my circulatory system flowing nicely to allow the stem cell transplants to properly take hold. So, on day 1, after all my preliminary testing was complete, I was moved to a private room where I enjoyed some coffee and an all-organic breakfast I ordered from the menu while I waited for my primary physician to arrive. This is Dr. Irina, who is both a medical doctor and a PhD working regularly behind the scenes in expanding Cell's research and development of fetal stem cell technology. This is Lena, one of Cell's managers and the translator assigned to me. At the start of each day, Dr. Irina checked all my vital signs and asked me various questions related to my overall health. After my physical exam, Dr. Irina carefully explained my entire fetal stem cell treatment program, which was an incredibly complex array of a variety of fetal stem cell types that were harvested between 7 to 12 weeks of gestation and scheduled across a 3-day period to seek a variety of goals to improve my overall health. The combination of fetal stem cells given to me on day 1 helps to create new capillaries and other small vessels across all of my organs, which help to deliver more oxygen and nutrition throughout my body, thus improving overall functions in my organ tissues. These cells also have very positive effects on the inner wall of big blood vessels, therefore protecting my vessels from atherosclerosis. And if there is any current atherosclerosis, it prevents it from progressing. They have a very positive effect on the liver, blood formation, bone marrow, immune, and hormonal systems, essentially giving my entire immune system a full reboot. They started first with a standard sodium chloride saline drip to open up my veins, followed by some anti-allergy meds just to be on the safe side. And after all of this settled in, they brought in my first round of fetal stem cells. Then it was off to see their masseuse, Yuri. The massage was about an hour, and frankly, the best massage I've ever had. Back to my room for a little lunch and relaxation, followed by hyperbaric oxygen. I had never been in a hyperbaric oxygen chamber before. It feels sort of like flying in an airplane, only with perfect high-density oxygenated air quality.
I'm doing fantastic, thank you.
Hyperbaric oxygen sessions are healthy anyway, but in this case, it serves as further nutrition for the fetal stem cells. And then I was off to the cosmetologist for the first day of my facial. My cosmetologist was Helena, who first gave my face a thorough cleaning before applying the key ingredient of this cosmetic therapy, chorion cells, which Helena had already prepared shortly before my facial began. Chorion cells are early fetal membrane cells that are rich in high-density nutrition, vitamins, and minerals. These cells are highly anti-inflammatory and regenerative when applied to the skin. And Cell is the only place in the world offering chorion cells as part of a cosmetic facial. The chorion cells were then carefully brushed onto my face. Helena then applied a rejuvenation mask containing aloe vera and other ingredients to end the session. And this was the end of my first day of treatment. I found MCell's staff to be most kind and professional, and they also provided transportation to and from the clinic each day. At the end of day 1, I really wanted to do some sightseeing in the beautiful city of Kyiv, but MCell's doctors requested that I take it easy and not exert myself too much. I stayed downtown near the central square of Kyiv, which provided a plethora of hotels, shopping, and food. Day 2. Dr. Irina checked my vitals, and I was given a second round of the same fetal stem cells I received on day 1. Off to massage, and then round 2 of hyperbaric oxygen. This is Dr. Maria, who was supervising my sessions. Not only is Dr. Maria a medical doctor, she received her PhD in fetal stem cell therapy. Back to my room, where Dr. Irina inspected my abdomen to prepare me for my first subcutaneous injections of the cells that will improve my neuronal or nervous system. These cells improve all processes regulated by my nervous system, improving all interneuronal connections, improving motor skills, as well as my autonomic nervous system, like heart rate, digestion, respiratory rate, and pupillary response, while also improving memory, concentration, sleep, and overall cognition, essentially giving my entire nervous system a healthy reboot. After a standard saline drip was completed, this combination of cells were injected subcutaneously into the fat of my abdomen. The reason for the location of these injections is because the fat of our bodies hold the most stable temperature and allow overall protection of these cells as they adjust to my body and begin to slowly release into my nervous system. And finally, day 2 of my facial. Helena started first by placing steam on my face to open up the pores, followed by applying more chorion cells. After allowing the chorion concentration to be absorbed by my skin, Helena prepared an alginate mask at a very cold temperature to then close my pores, sealing the chorion cells inside and further stimulating micro blood circulation. Alginate masks contain seaweeds, which stimulate collagen synthesis, improving the skin's capacity to hold the chorion cells and supply my skin with essential minerals and microelements. But they took this technique to the next level and introduced an electric impulse wand. And lastly, a little rejuvenation cream to end the session. And that was it for day 2.
Wow.
Well, at least at MCell, as I decided it was time to do a little sightseeing. The city of Kyiv is gorgeous and rich with history and culture. During my journey, I met an American from Pennsylvania who is in love with Kyiv as much as me.
I've spent a total of now 12 weeks here over the last year, and this is like the most wonderful city I've ever been in.
Mr. DeMarco is also an MCell patient.
18 years ago, I had a very bad motorcycle accident, and along with many other injuries, I suffered a broken vertebrae, spinal cord damage, and my brachial plexus nerve group was avulsed or torn out on my right side. Those nerves control my right lung, my scapula, right arm. After multiple reconstructive surgeries, I was left with severe spinal cord nerve damage pain. I was prescribed morphine, Mexaltine, Neurontin, many different narcotics. Unfortunately, none of them worked. They would somewhat lessen the pain for short periods of time, but nothing would stop it. I became addicted to the morphine after 2 years. I was taking over 200 milligrams of morphine a day. Let me describe the pain. There was 2 types of pain. It was a 24/7 type of compression, squeezing pain, which was more bearable than the shooting pains that I experienced. The shooting pains I could liken to a knitting needle that was heated over a flame and plugged into a wall and then stuck in your funny bone. And they would stick it in there for about 30 seconds and pull it out. And then stick it in there for 30 seconds and then pull it out. Jump ahead to a year and a half ago. I was here in Kiev on some personal business and found out about the stem cell clinic, M-Cell. There were no promises given to me, just that in the past it had helped people in my situation. I was advised to wait 2 or 3 months before I started tapering off the medication that I was on that was lessening the frequency of the episodes. And I have not had one pain episode since the end of December. First time in 18 years. I am totally pain-free and medication-free.
Dr. Irina checked my vitals as usual. And then time for my second round of subcutaneous injections. But this round of subcutaneous injections was an array of fetal stem cells to help me with my entire musculoskeletal system, which helps to improve my bones, cartilage, tendons, ligaments, and my joints and all their connective tissues, improving overall metabolic processes, while also increasing trophic and elasticity of my skin. Also increasing energy levels, triggering regeneration, rejuvenation, and overall high efficiency. Which also, by the way, includes a great improvement of sexual functions. Essentially, giving my entire metabolic system a nice reboot. The reasons for the location of these injections is the same for the cells I received on day 2. My third massage, and then back to my room, where they gave me an IV drip of amino acids to further improve my body's environment, giving the fetal stem cells the best chance of doing their job. The final day of my facial was just like day 1.
How do you feel, Eric? You okay?
Well, almost.
I just have to say it should be me there.
That was my wife and production partner who was holding the camera. She was so jealous of my facial, she wound up getting one too. And finally, it was back to my room, where Dr. Irina spent a great deal of time summarizing my entire treatment program, reviewing my blood, urine, and other tests they performed, and explaining to me why they gave me the types of injections and therapy they did. Each patient undergoing therapy at M-Cell has a completely different personalized therapeutic schedule, depending on their current health or any more serious ailments they may have. Since I'm pretty healthy already, I underwent M-Cell's Longevity Anti-Aging program back in Kyiv. After my 3-day treatment was complete, I spent a couple of days with Dr. Karpenko as he told me the entire story of how M-Cell came to be while showing me around Kyiv. Dr. Karpenko had worked directly in cooperation with Ukraine's Ministry of Health, allowing M-Cell to freely and legally come into existence.
It was since 1991 that such technology for clinical use was made, and we use it about 25 years, this year, 25 years already, and it is stable. We can predict what is going on, predict the timing of results, understand how it will behave, our treatment will behave in different kinds of diseases, in different ages, in different conditions of the patients. So this was the start of clinical use of fetal stem cell transplantation, not just a discovery of fetal stem cells or the first pioneer transplantation.
I took a tour of M-Cell's research facilities and quality control labs. I wanted to get a fully comprehensive understanding of how these cells are harvested and tested before being administered to patients. The process begins specifically between 7 and 12 weeks of gestation, where the fetal material from a legal, voluntary abortion with the donor's consent arrives at M-Cell within 2 hours of the abortion procedure. This fetal material then enters M-Cell's biotechnology laboratory. This is Christina, MCell's CEO and overall supervisor for all of MCell's harvesting and quality control laboratories.
Not everybody can come inside.
I know. I feel very, very privileged.
I would love you to see the process of the extraction of the fetal stem cells, but I'm very sorry, but we cannot film it.
That's okay. That's okay. Thank you.
So let's go.
Yep. After MCell's scientists extract more than a dozen different relevant categories of fetal material in their biotechnology laboratory, the fetal stem cells are immediately sent to the cryopreservation department, where they are then suspended using a special proprietary method. Once the cells are successfully suspended, they are then simultaneously sent to 3 different departments. During the research phase, the cells are tested for their functional activity, viability, and consistency. They need to make sure they are using healthy and thriving cells capable of expanding and replicating once injected into the body. This viability testing process also involves a state-of-the-art laser-based flow cytometer, which is capable of analyzing, counting, and sorting the fetal stem cells in real time up to 1,000 particles per second. While that is happening, this exact same batch of fetal stem cells is also being tested in MCell's microbiology lab, where each batch of fetal stem cells is tested to make sure they do not contain any harmful bacteria or contamination. This same batch of fetal stem cells is also sent to the polymerase chain reaction laboratory, where MCell's scientists carefully test each batch of fetal stem cells for any harmful viruses. Polymerase chain reaction is the method of molecular diagnostics that allows MCell's scientists to identify a single copy of the DNA and RNA of harmful pathogens. MCell's testing process is repeated 3 times to make absolutely certain that their fetal stem cells are up to the highest standards of viability and safety before being administered to patients. MCell has the largest fetal stem cell bank in the world. Quite often, people confuse fetal stem cells with embryonic stem cells when they aren't remotely the same thing. An embryonic stem cell is harvested within the first 5 days of development in a petri dish after artificial fertilization. Unlike fetal stem cells, embryonic stem cells haven't formed any organs or valuable tissue to take advantage of, regardless of the misleading hype in the news media. Not to mention that embryonic stem cells can be quite dangerous. The ability of embryonic stem cells to form non-cancerous tumors called teratomas is one of their defining traits. It's a frightening one, particularly for those who hope to develop therapies from these cells. In many cultures, including the Ukrainian culture, the vocabulary word for fetal simply doesn't exist, which only adds to the confusion, as in some cultures, the terms fetal and embryonic are used interchangeably, hence the name MCell. The vast power of the biological phenomenon behind harnessing fetal stem cells for therapeutic use can also be observed between a mother and child during pregnancy. Fetal cells migrate into the mother during pregnancy and can persist for decades. Fetal cells also appear to target sites of injury, crossing both the placental and blood-brain barriers. Fetal cells appear to change into whatever specific type of cell is needed, so fetal cells in a mother with liver damage could transform into liver cells. The fact that fetal stem cells have only 9 months to create an entire human being should help illustrate the power of these cells in comparison to any other stem cell type. When they enter your body, they are programmed to seek out anything that needs repair, redefining the meaning of the power of Mother Nature.